Hello everyone, this is my final presentation. My final presentation is on the Affordable Care Act and how it has helped millions of Americans. Before the Affordable Care Act was passed in 2010, millions of low-income Americans didn't have access to health care. Many avoided going to the doctor, not because they didn't need care, but because they simply couldn't afford it. For my research project, I wanted to understand whether the Affordable Care Act, or ACA, actually improved healthcare access and outcomes for low-income individuals, especially since it's such a controversial policy. At the beginning of my research, I assumed the ACA probably helped, but also had some serious flaws. I had heard mixed opinions, especially in political discussions, so I wasn't sure what the evidence would actually show. As I started analyzing academic studies, like research from Summers and Court Manch, as well as data from the Kaiser Family Foundation, I noticed a clear pattern. Most of the evidence showed real improvements in both healthcare access and health outcomes for low-income populations. This shifted my thinking. Instead of seeing the ACA as just controversial, I began to understand it as a policy that has made a measurable, positive impact, even though it still has its limitations, just like anything else would. One of the most important changes under the ACA was Medicaid expansion. Before the ACA, many people fell into what's called a coverage gap. They made too much money to qualify for Medicaid, but not enough to qualify for private insurance. The ACA allowed states to expand medical eligibility, which significantly reduced the number of uninsured people. Research showed that this expansion helped more low-income individuals access regular care instead of relying only on emergency rooms. Another key improvement was affordability. The ACA created insurance marketplaces and provided income-based subsidies. These subsidies help lower the cost of monthly premiums and out-of-pocket expenses. This matters because when healthcare becomes affordable, people are more likely to actually use it. It also reduces the risk of medical debt, which is a huge issue for many low-income families. The ACA also focused on preventative care. Many services like screenings, checkups, and vaccinations are covered at no extra cost. This is important because it allows people to catch health problems early instead of waiting till they become serious and expensive. It shifts healthcare from reacting to illness to preventing it. What surprised me most was how strong the evidence was in favor of the ACA, despite how controversial it was politically. I also didn't realize that many of the remaining problems, like gaps in coverage, are often due to state-level decisions, not just the policy itself. For example, some states chose not to expand Medicaid, which leaves people without access. This made me realize how much public opinion can be influenced by bias instead of just the actual evidence. This led me to a bigger question. What will the future of healthcare access look like in the United States? If policies like Medicaid expansion continue to grow, healthcare could become more equitable and accessible for low-income populations. However, if states continue to implement the ACA differently, these gaps in access may remain. So the future really depends on how these policies are expanded, improved, and supported over time. In conclusion, my research shows that the Affordable Care Act has significantly improved healthcare access and outcomes for low-income Americans. Through Medicaid expansion, financial subsidies, and increased access to preventative care, the ACA has reduced the number of uninsured individuals and improved overall health. While it's not perfect, it has made meaningful progress in understanding both its strengths and its limitations is essential for shaping future healthcare policy. Thank you.